Nutcracker Syndrome. Nutcracker Syndrome is also called left renal vein entrapment or Nutcracker phenomenon with symptoms. It is an extrinsic venous entrapment or venous congestion syndrome. Mostly, the left renal vein is compressed between the abdominal aorta and superior mesenteric artery. I said mostly because sometimes it's not the case, but you'll get to know in a bit. There is Nutcracker phenomenon. And why is that different from Nutcracker syndrome? In this case, the renal vein is compressed, but without any signs and symptoms. So, no complaint, and the affected individual is just observing all other daily routines. That is why it is called Nutcracker phenomenon and not the syndrome. It is known, meaning the Nutcracker phenomenon is accidentally discovered when there is a need for medical checkup or the physician is working on another particular diagnosis, but radiological investigation has been ordered. Then the diagnosis will be made accidentally. So, Nutcracker phenomenon is Nutcracker without any signs and symptoms, but when it is having signs and symptoms, it is Nutcracker syndrome. Why is the problem with left renal vein and not with right renal vein? Okay, let's examine that. The right renal vein drains the right kidney and returns directly into the inferior vena cava. It is very short, just about 2 to 4 centimeters. No tributaries. The inferior vena cava is directly on the same side as the right renal vein. That's why the right renal vein is not compressed by any structure around. On the other hand, the left renal vein, that is why do we have Nutcracker syndrome, is very long, about 6 to 10 centimeters. It drains left kidney with tributaries. It will get supply from adrenal gland, ovary, testes, lumbar vertebra, etc. And it must empty only into the inferior vena cava, which is on the right side. Therefore, it must travel across some structures, like abdominal aorta, or superior mesenteric artery, parts of the pancreas, and parts of the duodenum. Along the line, compression can occur based on the narrowness of the angle or space between that vein, meaning the left renal vein, and abdominal aorta with superior mesenteric artery, or left renal vein and abdominal aorta with vertebrae. So, we'll be dealing with superior mesenteric artery anteriorly, while the left renal vein will be in the middle and the abdominal aorta will be resting posteriorly. That is the anterior segment. But might be posterior Nutcracker syndrome, where we have abdominal aorta anteriorly, left renal vein in the middle, the spine or vertebrae posteriorly. So the anterior Nutcracker is all about the fact that it is the most common of the Nutcracker syndrome two types, with the compression of the left renal vein between abdominal aorta and superior mesenteric artery. Remember, I've just stated that superior mesenteric artery will be lying anteriorly, the left renal vein will be in the middle, and abdominal aorta will be posteriorly. So, anterior nutcracker is having left renal vein sandwiched between superior mesenteric artery anteriorly and abdominal aorta posteriorly. The posterior nutcracker is less common compared to the anterior and is rare with the compression of the left renal vein between the abdominal aorta and the vertebrae with retroaortic or circumaortic left renal vein. So, the left renal vein is sandwiched between abdominal aorta anteriorly and the spine posteriorly. Nutcracker syndrome or left renal vein entrapment with symptoms is found in all age groups, but it is more in teens and 20s. It is not diagnosed so much. Perhaps it's usually misdiagnosed. The focus is often on other possible causes of acute abdomen or other possible causes of abdominal pain or hematuria. Further explanation is that fat or adipose tissue usually maintains the space between the abdominal aorta and superior mesenteric artery. Loss of that will cause this problem. And many other factors could cause it. We'll go into that in a bit. Increased abdominal fat will favor its relief. Signs and symptoms. Majority will be asymptomatic, and then it will remain as nutcracker phenomenon. Since the affected person is not launching any complaint, most times they just live their life, without knowing that they have it. But even when it is nutcracker syndrome, meaning there are signs and symptoms, the signs and symptoms are non-specific. So let's go through some signs and symptoms. Abdominal pain on left flank, microscopic or gross hematuria. Remember, I've just said that mostly we go after other possible causes of hematuria or abdominal pain. So most times this is missed. Proteinuria, varicose with enlarged scrotum, male infertility. Other signs and symptoms will include pelvic congestion, that is more severe in women, dyspareunia in females, of course, dysmenorrhea, dysuria, and female infertility. Other symptoms or signs will be autonomic dysfunction, orthostatic hypotension, dizziness, tachycardia, headache, or fatigue. What could be responsible? Basically, it is all about narrowing of the angle between abdominal aorta and superior mesenteric artery or vertebrae or the spine when it is the posterior type. So that could be as a result of cancer or tumor malignancy, might be due to anatomical variation, particularly the posterior nutcracker syndrome with retroaortic or circumaortic left renal vein. Might be due to abdominal aortic aneurysm that is expanding and narrowing the space. Might be due to rapid weight loss or thin body. Might be due to malnutrition, in which case there is inadequate intake of the food or rapid loss of the same, and then the adipose tissue is reduced or decreased. Pubertal height changes might be the result due to growth spurt. That is why it's common in teens, 20s, lymphadenopathy, vertebral lordosis, intestinal malrotation, and pregnancy. How? Normally, left renal vein drains use blood from the left kidney and empties into the inferior vena cava on the right side. The inferior vena cava empties into the right atrium. The right atrium empties in the right ventricle. The right ventricle will pump the blood into the pulmonary artery and from there into the lungs, and the oxygenated blood will return into the heart via the left pulmonary vein into the left atrium, and then the left ventricle, and then to the aorta and the rest part of the body. This is, the normal way. Still on how we got here. The left renal vein is compressed anteriorly or posteriorly. Anteriorly, between abdominal aorta and superior mesenteric artery, or posteriorly between abdominal aorta and the spine. So we'll be battling with renal venous hypertension, congestion, pelvic congestion, varicose, and the list goes on. Then collateral vessels will be formed. These will be smaller and thin-walled. Still on how the system of tension in collateral vessels will end up in rupture into the left renal collecting system. In that case, the individual will come down with hematuria. Rupture between the engorged left renal venous sinuses and adjacent calyces may also occur, giving us hematuria as well. Pressure effect on other structures nearby and nerve fibers will give us abdominal pain. Differential diagnosis. If it is not Nutcracker syndrome, then it might be loin pain hematuria syndrome. It might be pelvic congestion syndrome. And it might be any of the possible causes of hematuria and any of the possible causes or differential diagnosis of abdominal pain. So the list is pretty long. Diagnosis: history and physical examination. After that, we'll proceed to have Doppler ultrasound, CT angiography, MRI angiography. We can head to lab and have urinalysis done, complete blood count, clotting profile, liver function test, renal function test, and others as you deem fit. How do we treat? It depends on the severity and presentation. Acute resuscitation or conservative management or surgery could be in place. We will need acute resuscitation when we are dealing with hypovolemic shock. Severe anemia with massive hematuria will need transfusion. Unbearable or excruciating pain will be attended to quickly. In children, it is better to have conservative management. Increase weight or increase fat intake to gain some abdominal fat and get more weight is advisable. This is the first time ever that I will personally be encouraging anyone to gain weight, that I will be encouraging anyone to build more fat, particularly abdominal fat. It is because of Nutcracker syndrome. Conservative management is welcome in children, But if we are not winning, we change direction to surgery. Medications like angiotensin converting enzyme beta and aspirin could also be made use of. But discuss with your team and find out what is the protocol in your jurisdiction. In others, conservative management is not gaining ground so much. If I told you are going to embark on conservative management, let it be for short period of time. Then quickly make the appropriate referral to the surgeon, where they can have stenting, transpositioning of the affected vessel, and kidney auto transplantation done. Complications. There may be venous thrombosis, with or without embolism. Chronic renal disease can set in, and chronic or debilitating pain might be the case, and some might run into severe anemia. Prognosis. This depends on early presentation and the severity at presentation. If you present early, the prognosis is good. If it's not so severe at presentation and you could be assisted promptly, the prognosis is good. In all, there will be better outcome with the children than the adults. But it depends on the time of presentation and the severity at presentation. Thanks for listening. Nutcracker syndrome is not supposed to kill. All we need to do is if you have any complaint, please just approach your physician. Your complaint or complaints will determine the direction of intervention. And through that, they might be able to make the appropriate diagnosis of Nutcracker syndrome and you'll be assisted appropriately. Please remember to share this with your friends. Remember to subscribe my channel if you haven't. If you have subscribed, I'm saying a big thank you.